Hello and welcome to 15 Minutes with Longevity. I'm Giselle Wertheim Aymes and I'll be your host. My guest host is Dr. Sidi Gooley, a founder and director of Medispace Wellness Clinic. Hi.
Always good to have you here.
Nice to have you too, Sidi.
Oh, thanks, Jean.
Today we're going to be talking about non-invasive surgery and the benefits behind it. With us in the studio, we have Dr. Maureen Allem. She's from the Skin, Body and Health Renewal Clinic, as well as Dr. Anushka Reddy, a medical director at Medisculpt. Dr. Allem, first to you. It's such an interesting area because I think it's one of the areas, if we look at the beauty industry, that is growing, the whole idea of non-invasive. Perhaps you can tell us a little bit about what does that mean, non-invasive, and is it true it's a growing category? Why is it a growing category in the health sector?
Okay, non-invasive is when you're not physically changing the body. You're not taking something out of the body, you're doing it all non-invasively. So we make sure that we keep to that non-invasive byline, non-surgical solution. And when I started 12 years ago, women wanted, Botox and fillers. They came in and now they actually need it. They're realizing, that all their friends are doing it. They keep very quiet about it, but they are definitely coming in more and more. And they're starting much younger because they don't want to age like their mothers have aged. So they're starting from the age of 25 to 30. They've read that, when you start Botox earlier on, you can actually prevent the aging changes that take place with age.
So, but non-invasive, obviously Botox is the most well-known. I think most people know Botox. I think it's the largest drug in the world, I understand. The most marketed drug in the world at the moment. But there are a whole lot of other treatments, like lasers and the like, that are also used. Is that correct?
Yes, absolutely. Botox and fillers make up about 35% of our practice. But it depends on the person's condition. If they come in and they really need more help than just a non-invasive treatment, then we will do a more... still non-invasive, but more aggressive kind of treatment, depending on their sun damage. So there are many, many more treatments. There's a laser hair removal that we do. A big part of our practice is pigmentation, because the young girls normally start coming in at about 29, 30, and they sometimes even men come in and they say, "What is this stuff on my face?" So that's a big part of the practice, trying to educate the public on how to treat and how to manage pigmentation, and also going to the right clinic to make sure that you don't make your pigmentation worse.
I think that's probably quite an important area, because I think as we see this as a growth area, there are a lot of suppliers or I wouldn't say clinics, maybe rather I should say outlets where you can get exactly. And I think it's probably a really important subject, and I know close to your heart, Dr. Reddy, because you also are involved in an association that tries to create standards in the industry. In the non-invasive field, are you regulated like other medical fields or not? And how do we get, as a consumer, to understand when we're looking to use these treatments, how should we go about it? How do we choose who we should use?
Like you've mentioned, it's very true. The Health Professions Council of South Africa doesn't have any definite guidelines as to how aesthetic practitioners, medical practitioners should behave. If I could use that word. We have to, however, follow guidelines. We have different ethical guidelines. Booklet 2 and 5 specifically will be relevant to the way we practice. And I think that, for me, the biggest problem facing aesthetic practitioners today is, the doctors who go out to beauty salons and non-medical facilities and offer these type of procedures there. I think that's a complete no-no. It's unethical, firstly. It could be seen as a perverse incentive, especially if the doctor is paying a commission to the beauty salon owner. I've even heard a story of a doctor visiting a hairdresser offering these treatments. And I think, the minute you start dealing with those type of scenarios, alarm bells should start ringing, especially in the consumer's mind. They should start looking at, okay, these are medical procedures, they should be offered in a medical facility.
So they are medical procedures. I think, again, I don't think people really, I deal a lot with consumers, and I get the sense that they think it's like just going to a beautician. We can just, we can go to a Botox party and pass a bottle around.
Or a spa, these pamper parties that people are used to.
But you are talking, you wouldn't go to just any doctor for surgery, for a facelift, for example. So you're really saying that if you're going to have an aesthetic procedure, surely also there's the element of what happens to you. How a doctor looks at what you are as a person. I mean, it can't be a simple thing that we're just going to do this or do that.
Yeah. I think training is very important. You know, it's just unfortunate in South Africa we don't have any formal training offered by any recognized university, but that may change in the near future. Stellenbosch University is looking at actually establishing a diploma in aesthetic medicine. There are international schools that offer it in South Africa, and that's probably, you know, one of the routes that one could look at, enrolling for if you wish to practice in this field of medicine. The alternative is to attend conferences, attend training seminars.
Okay, so the consumer really should look for a doctor who's got some credentials.
Courses. You know, with the aesthetic committee, we do have a course called the FPD Fellowship for Professional Development, and they do a 2-year course on cosmetic, what we do, aesthetic surgery.
But I think that's sorry, Maureen, I just want to come in right there, because that's the ambiguity sometimes for us at a level of even a primary practitioner level. There are obviously a growing number of women who want to look after themselves.
Don't forget the men.
Of course, and the men who want to look good and feel good. And I mean, we know this phrase very well now. What's critical from a consumer point of view is the quality of the practitioner that they're going to. We hear so many stories, and we know of certain shows that cover all the charlatans out there. And the worry with aesthetics, I think, for a lot of people still is, how do I know, when I don't have the medical qualification, that I'm going to a person who knows what they're doing, and what certification qualifies? Because exactly as Anushka has said, there is no constructed course yet in a South African sense. So, you know, you've got the 3-month diploma, you've got the 2-year diploma. That for me is the controversy of the quest for beauty, is knowing if I'm going to the right people and if I'm not going to live to regret it.
You know what, as all things go, theory guides, but practice decides. The more Botox and filler treatments you do, the more you learn. And even after 12, 13 years, I'm still learning now. I'm still finding different ways to do the Botox. I mean, it's quite amazing. And you can go to the same doctor, like I train our doctors, and I'll train the doctors exactly like I've trained them. But just that millimeter to the left, to the right, makes a huge difference to how the face turns out. So it's very important to go to someone who knows what they're doing, and very important to go to a place where the doctor can actually handle any adverse reactions. Because you can, especially with the fillers. You know, very often patients want fillers around the glabella area.
Yes.
And that's a particularly dangerous area, because not only can you get necrosis of the area if you infiltrate one of the arteries, but that artery, 2 of these arteries also lead back into the eye. So it's very important that you know where to put fillers. You know, because I've heard of beauticians doing fillers, you know, just pumping the people up. So it's very important to go to a practice that has genuine and FDA or CE approved fillers.
Correct. And they should just
and tried and tested,
And I think also they need to ask, especially if it's a first-time patient, to have a look at before and after pictures, a library of procedures that have been done.
So how the doctor actually conducts themselves.
Yes, absolutely. You know, I think that's pretty fair. And to also question the doctor about their level of experience. How many years have you been doing this, you know? And I think, and most patients, you know, when doctors offer procedures to patients, they often talk about the positive aspects of patients, and I think they'll completely forget mentioning negative, you know, aspects, because nobody wants to listen to the fact that yes, you may Botox the glabella, but you run the risk of actually dropping the brow. But it's important that you, as a doctor, also inform the patient. You know,
just quickly, I'm going to ask you too, because we're running out of time as always. The one treatment that you think makes the biggest difference to a face, and certainly in terms of aging, both male and female. I'll start with you, end with you, Maureen.
Okay. In my practice, 80% of the procedures I do is based with dermal fillers. So for me, dermal fillers are very much the elixir of youth. I use it all the time, and there's so many new novel techniques that we are now, you know, using it for. We're using it to lift the face, you know. There's a procedure called a 3D vector lift. I won't say that it replaces a surgical facelift, but in the right candidate, it offers beautiful results, you know, that last for up to... And natural. The emphasis is always natural, you know.
And all skin types.
All skin types. And I think with fillers, the results are instant. You know, it's immediate. It's also, and what I like about it is the fact that it's not permanent. So it can be, you know, dissolved.
I know. We
always run out of time. Well, thanks for coming to the studio today. It was very, very interesting, if not a little bit short. Well, that's it from us. Thank you for watching, and we'll see you here again next week for your dose of health news.
Goodbye.